That first case of Ebola diagnosed here in America. The patient quarantined now in Dallas, and there you see the ambulance. He rode to the hospital. It's out of commission right now. The EMTs now quarantined as well. More than 3,000 deaths have been linked to the disease in Africa, the worst outbreak ever. It's still spreading. We've got full team coverage from Texas to Africa, starting with ABC's Cecilia Vega outside the hospital in Dallas. Good morning, Cecilia.
George, good morning to you. That patient is being kept here in isolation in an intensive care unit. Those doctors and nurses who are treating him, they're wearing double layers of protective clothing just to keep them safe. The CDC telling us that it has been expecting an Ebola case to arrive on American soil, and now that it's here, they say they're ready for it. This morning, a frantic community searching for anyone who may have come in direct contact with the Ebola patient, now in critical condition in this Dallas hospital. As investigators hone in on roughly a dozen people the man came into direct contact with, including the first responders who picked up the unidentified Liberian man Sunday in this ambulance, now under quarantine, as well as 4 or 5 children and several adults, possibly family members in Texas the man was visiting. Can you tell me anything more about his condition?
I can't tell you anything more. Yesterday in the press conference, one of our physicians described him as awake and talking and hungry.
He's awake, he's talking, he's hungry. That's a good sign right now.
Well, that's better than other things.
The man left Liberia September 19th, apparently already infected with the disease but not showing symptoms, meaning he wasn't contagious to fellow passengers on the plane. Officials have not confirmed the route he took, but the man likely had layovers in 2 or 3 cities, potentially in both Europe and the U.S. The journey can last as long as 43 hours. He landed in Texas September 20th. But on the 24th, symptoms of Ebola began, triggering the possibility of spreading the virus. On Friday the 26th, the man came on his own to Texas Health Presbyterian, but was released because doctors said his illness did not seem unusual. Finally, on the 28th, he returned to the hospital, this time rushed in an ambulance, and was admitted. On Tuesday, tests confirming the man has Ebola. Authorities say they are confident the situation is under control.
I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely.
While the city of Dallas remains on high alert, the mayor activating this emergency operations center. And the CDC has dispatched what it calls a team of disease detectives here to Dallas, vowing to take every precaution to make sure that this epidemic that has spread through West Africa does not spread here at home.